and nutrients and minerals and gets them everywhere because there's tubes literally everywhere. And then it picks up used blood and used plasma, which is just the water that needs to be in your blood to carry all the dissolved hamburgers and vitamins and all the stuff you eat, right? So here's the scoop though. Sometimes, well, two things happen. Sometimes your cells expel, get rid of trash that's too big to get picked up by a capillary and get back in your veins and get back to your heart. So it's just like, anybody here have bulk trash pickup at your house? Right. So you can put out the regular trash, right? But sometimes you'll throw out a sofa and they won't pick that up with the regular trash. But the bulk trash will come along with a big bulldozer and throw the sofa in the back of the thing. Well, you do have bulk trash in your body. Trash is a strong word to use, but you have amino acids and protein chains and by the way, foreign bacteria and viruses and stuff like that are too big to just get back in the bloodstream after a cell goes, bleh, we don't want this. And you also get foreign invaders. So your lymphatic system also helps with foreign invaders. But one of the things your lymphatic system does is pick up stuff that your venous return can't pick up. And it's estimated that about 10% of all the blood that pumps out of my heart doesn't get picked back up by my heart. So I'll explain that. But and by blood I mean the plasma, everything. But this liquid that comes out of my heart, I think you pump out about 20 liters a day, and only about 18 get picked back up again. And that's because some of that stuff is just too big to get back in the venous return, and also it's kind of done on purpose. So as a security check. So if I wanted to stop weapons or drugs on campus, I mean, we obviously don't have problems. I'm not worried about you guys. But if let's say it was just a tough school and I wanted to stop weapons and drugs on campus, but we had to get you guys in the building still quickly, right? This is kind of like my blood supply. My blood supply can't be stopped to check every single cell going by. It can't be. I need too much blood too fast, too quickly. I couldn't have 200 students stand outside our doors and frisk every one of you and put you through a metal detector before you came in. It would take too long. But what we could do is pull a random 10% of you aside every day and check those people. And that's partially what your lymphatic system does too. Because your heart doesn't pick up all the plasma and blood every time, sometimes it's because it's too big, but some of it's just because it's sloppy. It just doesn't pick it up. And sloppy is not right. I'm sure it's by design. Well, your lymphatic system picks that up. And your lymphatic system will return all of this plasma, all of this blood back to your heart, but it does it very slowly. And it does it very slowly because it sends it through a whole bunch of security checks on the way back to the heart. And so, you know when you go to the doctor and they feel you right here and they go, oh yeah, you're sick? They're filling your lymph nodes. These are tiny little pea-sized, by the way, when you're sick, sometimes they're not pea-sized, they're really big. But these are tiny little pea-sized filters, and you've got thousands of them that are on your lymph vessels. And they get swollen up when bad stuff goes through them, not because it's a bad thing, but because they're kind of holding on to that stuff and devouring it. And so your lymphatic system plays an important role in your circulatory system because it gets the rest of your blood back up to your heart. And if you didn't get 2 liters of fluid back to your heart every single day, you'd blow up like a balloon overnight, right? That's a lot of fluid that would be left in your tissue. And also by constantly grabbing 10% of your fluid and doing a deep cleanse on it, it's keeping you safe from foreign bacteria, viruses, and all that stuff. So it's also part of not just your circulatory system, but your immune system. Because your lymphatic system picks up this 10% and your lymphatic system is loaded with white blood cells. And it pulls your fluid back through these areas, through all these little lymph nodes, hundreds of them, and it's got hundreds of opportunities to clean up this lymph, which is your blood, before it dumps it back in your heart. And it dumps it back in your heart by taking it back up to the right atrium. It just goes into the vein right before it gets to the right atrium and dumps it back in there, but it's all clean by then. So that's the lymphatic system. That's kind of an overview of what we're going to talk about. It has its own veins. They're not veins, they're lymph vessels, but they are tubes. They tend to be bigger than your capillaries, so they can pick up bigger stuff, but that's what they are. So, yes, Mr. Kandaris, sir.
So, like, would lymphatic massage be good for someone with a heart condition, or like maybe to prevent edema or other
Yes,
stuff like that?
lymphatic massage is used to prevent edema, which is swelling in an area for sure. Also, advanced lymphatic massage, and I say advanced because, and I am not an advanced lymphatic massage therapist. There is a school in Australia, and I think it's 2.5 years just to learn their lymphatic massage. People that are really good at it, it's a very light massage, by the way, everybody. It's light, believe it or not. They get very good at following the lymph channels and moving lymph along, and they can help kind of accelerate your body's process of doing lymph. And I've seen amazing things where people have like open wounds and infections and stuff like that, and they do all this lymphatic massage and it clears up like very impressively. So we offer weekend courses, not at Gateway, but I'm in the Valley here. You can take weekend courses in lymphatic massage. I'm a little skeptical how good you will be at it after a weekend course when there are schools that teach 2-year-long courses. But yes, lymphatic massage is technically used when somebody is having problems with their lymph moving, when they have an infection, when they've got swelling. It is a neat thing to take a weekend course in, just so you can also, like, if you will occasionally, it does happen, maybe 1 out of 100 clients, get somebody who likes really light massage, or you're afraid to do anything else to them, but they want a treatment. And I'm not talking about scamming people at all, but let's suppose there's a lot of people that still want to get their massage, but they can't handle pressure. And lymphatic massage is a really great thing to offer them, because what they want is the care. And the lymphatic massage still has that care. And I will talk today about the basics of lymphatic massage, like the concept behind the movement, which is very important. But I'm no lymphatic massage expert, just to let you know, at all. Not even close. Yes, Mr. Brown.
In our book, is there a chapter that does the chapter go over the basics and stuff?
Well, there is a chapter. I mean, chapter 27 is on lymphatic system, but I don't think it's on lymphatic massage. It's been a long time since I read it.
It's just the system, because I was looking at it, and I didn't think it said anything about massage.
Yeah. And I
was interested in taking a course for lymphatic.
Yeah.
With a P or with the F?
PH, yes.
I was interested in it.
You should take it. I had a student about a year ago who graduated from here, took quite a few lymphatic massage courses, and that's all she does. And she works for, I want to say, a plastic surgeon, and does lymphatic massage on all the people that receive surgery afterwards to help with the swelling. And she's got a sweet deal where she gets all of their clients, and that's what she does. So there is a career in it, truly, no doubt about it. Yeah. Mr. Brown, I have a question for you, though, sir.
Yes.
Did you get the bitchin' sauce?
I didn't get the bitchin' sauce.
We're done here, Mr. Brown. We're done. Okay. You're missing out, buddy. All right. Anyway, cool. So yeah, check in on those. Are great continuing ed courses to see if you like it. And there are some here in town too. And then if you really like it, you can go in depth, take a month-long course on it or whatever. All right. So let me share my slide presentation on the lymphatic system. Boom. All right, everybody. So this is the bulk trash and police system and part of your body. It's meant to pick up fluid your heart does not pick back up, that would just sit and collect in your tissue, and you'd swell and swell and swell. The lymphatic system gets it back out, and it makes sure to clean it up along the way, give it an extra heavy dose of white blood cells, because your heart doesn't have time to do that. It's got to keep pumping the blood, keep giving you the oxygen, all that kind of stuff. So this is kind of a deep cleanse system for your body. Yeah. Boom. It's one of the reasons, by the way, we think foot massage is good too, because we think a lot of lymph pools in your feet, because it's a low pressure system. Okay. So the lymphatic system collects interstitial fluid. Interstitial fluid is the fluid found between the cells. That's all it means. But it's a pretty important term to know, interstitial fluid. You'll hear it a lot in massage, at least in a high-level massage, because we are trying to pump interstitial fluid in and out of tissue. When we're working on tissue, we're probably not really pumping fluid in and out of cells because they kind of choose when they pull in fluid and let fluid out. That's kind of up to the cell. But our job is to get the best, cleanest, healthiest, most nutritious fluid we can around those cells. And buildup of fluid around those cells is what causes swelling. When you are swollen, you've got too much interstitial fluid. And again, swelling can have some good things, but carried too far can be a problem. And your lymphatic system literally keeps you from swelling up. So it collects interstitial fluid. I'll get to the second part in a second, and delivers it back to the cardiovascular system. It does also help you process nutrients from your digestive tract. And it's kind of like, well, why? We've already got capillaries down there picking up food and stuff from my digestive tract, and they mean from your small intestine. There's capillaries on the walls there, and the fluid and the food that you eat kind of seeps into those capillaries, and that's how you get the hamburger that you ate today to your little pinky. But what doesn't go through the small intestine very well because they're terribly big is lipids. What are lipids? What's the short word for what lipids are?
They're fat.
Fats. Yes, and fats are good. I understand there's a certain point where they're not good anymore, but fats are good. They are used for all sorts of reasons, and they actually help carry certain vitamins in your body. You make your hormones out of fats, many of them, not all of them. You need fats. They're really a key thing. But they're hard to digest. They're hard to get out of your intestines, and the lymphatic vessels are big enough to pick up the fats, process them, and get them into your body. And I know fat's gotten a bad rap in our society, but fat itself as a nutrient is a good thing. We probably just all eat too much of it. And by we, I mean me. Anyway, so the lymphatic system collects the fluid that builds up in your tissue, which we call interstitial fluid, the fluid between the cells. And it also picks up some fats from your digestive tract, and it gets it all processed, cleaned up, so your body can use it and dumps it back into the cardiovascular system, right back at the top of the heart to start all over again. Cool. I don't really like these terms here, but I'm sorry, I'm just thinking about how to explain this to you. You've got two types of lymphatic tissues in your body, two types of lymphatic things. One is the very obvious stuff, like you've got these tubes that are called lymph vessels, and you've got lymph vessels, and these tubes connect to bigger tubes, connect to bigger tubes, connect to bigger tubes, and they've got little lymph nodes on them, which are little filters full of white blood cells, and I'll show you a picture here in a second. And that all makes sense. If you saw these straw-like tubes kind of connecting like veins in my body and with these little lymph nodes on them and going back to the heart, you'd say that's the lymphatic system, and you'd be right. But you have other tissues in your body that are considered part of the lymphatic system, even though they're not connected by tubes. These are other tissues in your body that produce lots of white blood cells, really, and help clean up your lymph as well. So your spleen, that actually is a blood filter, is loaded with lymph tissue and creates a lot of white blood cells to help clean you out there. Your bone marrow creates white blood cells, so we consider it part of the lymphatic system as well. So I just want to kind of explain, yes, you've got all this tubing to pick up the interstitial fluid and get it back to your heart, but you've also just got like your tonsils, your adenoids are loaded with white blood cells, and that's their purpose. Like my tonsils back in here are meant to catch stuff going through the air, capture it, and destroy it with white blood cells. Yes, Ms. McDowell.
What's the difference between tonsils and adenoids? I know they're always put together. I have mine removed, so I don't have those. But what's the difference?
Well, I know the tonsils are right in your mouth, and I think adenoids are up higher and associated with what's going through your nose. And so, but beyond that, they're the same in the sense they're both doing the same thing. That's their job. And so I would have expected your next question, but you're not going to ask it, would be like, how are you okay without those things? You're not okay? You are okay, or you know that.
Well, I think the way that my mom explained it to me is sometimes they are removed because they're swollen too much and you're not like really sick, so they are kind of broken. At least that's why mine were removed. They were so swollen I was having trouble swallowing.
Yeah. So, yeah, they're usually removed because they get inflamed too much and they can't quite figure out why they keep getting inflamed, and they figured just remove them. And that's common practice. There are some people that argue that that is a very bad idea because they do serve a purpose, and that's to stop infection. But what I was driving at is the reason that you're still basically okay is because your body is loaded with redundant systems. So even without your adenoids and your tonsils, assuming they haven't grown back, yes, lots of people have their adenoids taken out and they grow back. And yours might be back in there just happily taking care of you and all that good stuff. Anyway, but you have lots of redundant systems, so you can mess with your system because normally I'd be like, don't cut out part of your defense mechanism. That's crazy. But luckily you've got enough other lymphatic tissue and white blood cells other places that you're still going to be okay. But they are designed to be gatekeepers. That's the reason to not remove them. Mr. Brown.
I actually got mine removed as well.
You had yours removed
Because
as well,
when I
sir?
was a kid, they were so swollen that when I would sleep, I would stop breathing for like 10 minutes at a time, and I would snore like super bad. And my mom was like, "All right, this has got to stop." And the doctors, like, I had to stay at the hospital one night, and the doctors was like, "He's not breathing." And they like, it was like a big thing, like a whole hospital came because I like stopped breathing for like 5 minutes, and they were like, "All right, we're gonna take those out."
Yeah. That would make perfect sense. And in a way, Miss McDowell's kind of described the same thing, maybe not as extreme, but the point was they were so swollen that it was actually making it hard for her to do other important things like eat and breathe. You know, that's a problem. Yeah. Anyway, and it is possible what's happening is they're overreacting to non-threatening stuff like pollen in the air and things like that. But anyway, their purpose is to be gatekeepers. And they're not connected by any lymphatic vessel to anything else. They're just sitting there producing white blood cells and trying to catch foreign invaders before they get down your throat, in this case. So you've got stuff like that too. So you've got kind of like lymphatic organs, like adenoids and tonsils that are trying to kind of help you out there. And then you've got the lymphatic system of these tubes, these lymphatic tubes that are really picking up liquid and filtering it through lymph nodes and getting it back in the heart. Cool. All right. So their job is to remove excess interstitial fluid, right, to stop swelling, transport fats and fat-soluble vitamins. I feel like I already said all this, basically. And they are part of your defense mechanism, too. Yes, Miss Sarno.
Yeah, can we work on this area to open up?
Yeah. I don't know if it'd help your adenoids or anything, but yes, I work on this area on people all the time. I love this area. Yeah. You guys, when you're laying in bed, you guys should play with your faces because there's a lot you can do with them. You'd be surprised what like the little weird little nooks and crannies that you can get in there. Yes, but anyway, Miss Sarno, yeah, I like that idea. Yeah, very good.
Because that time my husband just not breathe. He cannot breathe. I just open this way up and he just come back.
Oh, so it did work for you.
Yeah, it did work for me that time. And
yeah, I believe it. We have lots of hollow areas in our head, so opening anything up here could do it. I've definitely had people work on my face. I could hear like where you hear your sinuses pop inside and open up. Yeah, not pop like that. Just like little, like when your ears pop. This big time. Oh my god, I love this class. Okay, all right. This is just a definition. This doesn't change anything what I'm about to share with you. So interstitial fluid, which is kind of leftover blood and plasma between your cells, when it gets inside a lymph vessel, we call it lymph. It didn't change. That's what I want to point out here. But when the blood and plasma that's between my cells gets inside a lymphatic vessel, we call it lymph. When people talk about lymph, they're talking about something inside those vessels, going to those lymph nodes, but the fact is it's still blood and plasma. It's still the stuff your heart was beating around. We've just now given it a new name because now it's inside your lymph vessels, and so we call it lymph. So when people talk about moving lymph, they're talking about moving stuff through your lymphatic vessels, but that stuff is plasma and blood and such. Yes, Miss McDowell, please.
So I think I remember you saying that plasma is like 90% like water.
You have
What's
a very
what's
good
the
memory.
other stuff?
Miss McDowell, why do you always gotta ask that? I actually do kind of know. The other stuff is amino acids, which make up proteins, but they're in their small form, and so they're carried around the body, and your body reassembles them to build stuff. And vitamins and minerals.
So it's just like extra stuff in there, like in the blood, but it's in the plasma. So it's just like, hey, if you need this, you can take it.
Yeah.
Okay.
Yeah. Kind of like so in a way the cells of your body are kind of in a murky swimming pool, but the swimming pool is chicken noodle soup, and if they need to drink it, they can. Yeah. And plasma's kind of like Gatorade. And I say Gatorade because it's about that consistency of mostly water, but it's got some important electrolytes like potassium and salts and some other little sugars that you might need. Yeah.
Okay.
Yeah. All right, so, and then once the lymph goes up through the lymphatic vessels and get back into my heart, all of a sudden we call it plasma again. We're like, it's now plasma again because it's back in here, and that's what we talk about the liquid in my blood. So those are just definitions. Don't get caught up on them. But you should know what lymph is and where it comes from. Lymph is the interstitial plasma fluid that your heart didn't pick up, so it's in your lymphatic vessels, and once it gets back to your heart, it's going to go back to plasma and eventually go back to being interstitial fluid because it'll be back between your cells again. Yeah, the circle of life. Okay. Let's see. Okay, I like this diagram actually. This diagram is a pretty good diagram where you can see the lymph vessels. By the way, again, you've got way more. These are just big ones. Where you can see the lymph vessels. All the little green P's you see in it are lymph nodes, and they really are filters with lots of white blood cells in them. So that lymph kind of goes up there and it gets in one of those lymph nodes, and if there's any bad guys in there, it eats them as it's heading back up to the heart. Now, they show some other stuff in this picture because, as I said, things like your red bone marrow that makes white blood cells and things like that is considered part of the lymphatic system. It's not hooked up to the duct work, but it's part of that. And your spleen is part of that. And they have Payer's patches there too. Payer's patches are just really patches of little lymph nodes that sit on your small intestine. We'll talk about them more in a little bit here, but they're literally there because to catch any disease coming out of your intestines. Because eating is a very dangerous thing. I didn't kind of go over this part, but eating is a very dangerous thing. And if something gets past the acid in your stomach, which sometimes it does because it's wrapped in kernels of other stuff, as your body's picking up the fluid out of your small intestines, you don't want it to be picking up bacteria out of your small intestines, because once it's in your circulatory system, it's going everywhere. And so you've got extra, they're called Payer's patches, and they are patches of lymphatic tissue with loads of white blood cells, and they're kind of along your small intestine to catch any problems brewing in there, so that if something starts multiplying that shouldn't be, they'll attack it. But anyway, they too are considered part of the lymphatic system, and you can see the tonsils here and all that kind of stuff as well. Actually, this might be an important time to make this point too. You have lymph nodes, these little pea-like filters that are along these lymphatic vessels all throughout your body, everywhere. But you've got larger amounts of them at the folds of your body. This is a Tapscott statement. I don't know that your book says this. This is just a way I remember stuff. What I mean by the folds of your body, your groin, your axillary region, places I bend, tend to my neck, my stomach even, tend to have large accumulations of these things. So this is why people will check your neck when you're sick. That fold tends to have a lot of lymph nodes, and so it's very easy to pick them up. People under their armpits and stuff will sometimes even get hard little pea-like things under there. Those are the lymph nodes swollen and irritated. Right in your groin where your legs kind of come together and meet your body is another place. So it's just a really easy way to kind of remember where your main lymph nodes are located, is the folds of your body. And you can kind of see it in this diagram, the way they've drawn it. Okay. So I'm going to have to draw you a picture. I'm very sorry for all of you because we know that I'm not good at this, but I want to talk to you about how this works. Like, how does your body know to pick up extra stuff? When does it know? Hold on. Don't want to pull the cord out of the wall. Okay. Let's go right here. Bam. All right, cool. Let's get rid of this. This will not be a very exciting picture, but I hope it'll make a point. So, out of the sky, way up here, is a lymph vessel coming down. I want to make sure I'm in the middle here. Like that. It's going back up to the heart. They actually are capped at the end. Your lymph vessels are actually capped at the end. And they're kind of clever. They've got little doorways on them, like this. And believe it or not, these doorways even have a little squiggly like string, it's not a string, that is in the tissue. Now I'm going to explain why this is so important. Can you imagine that if I didn't have much swelling, all my tissue would come together? If I didn't have much tissue, if I didn't have much swelling, my tissue kind of comes together and these doors close. And we want them to close because if I don't have much swelling, I don't need to pick up extra fluid. But you know, when you swell, you literally puff out, right? Well, if I puff out and these strings are in here, what happens is they pull the doorways open. And now fluid can get into my lymphatic system easier. It's very clever. So as you swell, it opens the doorways to your lymph vessels, so hopefully they will bring in more fluid. It's kind of cool. And then as the swelling goes away, the tissue comes together, the strings come together, and the doorways close back up again, so you don't keep taking fluid away because you don't want to take all the fluid away. So it's a very automatic system. It's very, very clever. I love it. All right. There's one, and that's what this slide is, by the way, talking to you about, is just how this actually works. And those are the anchoring fibers that they are referring to. These are the
Mr. Tapscott?
Yes, please.
So does that mean like when my hand was swollen and then it went down, like as it was slowly opening, closing the lymph thing that you were talking about?
Yeah, I mean, if I understand you correctly, that's exactly what happened. Your hand puffed up, it pulled those anchoring fibers, millions of them, by the way, and probably millions of little lymph vessels, but it pulled them because your hand got bigger. Your hand got wider, literally got wider. So to us, it wasn't that big a deal, right? It was a minor, but it still got wider. And that means that vessel, that little anchoring filament doesn't have to move very much, right, to open up a microscopic door. So that tiny bit of swelling opened up a whole bunch of doors. Your body was like, oh my God. And it was probably actually pumping extra fluid into the area to clean it out, but your lymph was picking up extra fluid to make sure that it was cleaning that out too. So it was increasing the healing circulation in your hand at that time. Very cool.
So then did the lymphatic system pick up the extra blood back after it was done healing? Or did like that doorway open? Is that like what you were saying?
I feel like you just said the same thing twice, like in my brain. So yes, the doorway opened up, which picks up the extra blood or the extra plasma.
Hmm.
And then as your swelling went down, the doorways start to close down a little bit. What?
Sometimes I get caught in a circle, so that might have happened.
Yeah, I'm sorry. Well, no, I might have just misunderstood you. You might be trying to make a finer point that I'm catching. But yes, as your hand tissue expanded, your lymphatic system was picking up more fluid, and eventually it picked up enough fluid and enough healing occurred that your hand started to go down, and then the door started to close.
Okay.
Why didn't that happen right away? Is because your body was probably also, while your lymphatic system was swollen and picking stuff up, your body was probably actually sending extra fluid to that area to heal it. So, do you know how your mom brings you chicken noodle soup in bed when you're sick?
Well, not anymore, but yeah.
Well, she needs to start again. I'll talk to her. But when you're injured, your body tries to swell an area. It tries to pump fluid into it so it can get lots of nutrients there and lots of white blood cells, and so it can flush it out. Just like you would run a cut underwater or something like that, it's trying to run an internal cut underwater. And so while it's doing that, your lymphatic system's like, that's fine, but there's swelling here, and it's sucking that out. So you have an increased amount of fluid going through that area, and you want an increased amount of fluid in there. There's lots of good clean plasma coming in, clean white blood cells coming in, but it's creating swelling, and the lymphatic system's working extra hard to get it out. And eventually what happens is you start healing and your body stops sending so much fluid there, and the lymphatic system takes out the rest and everything's back to normal. Did that help?
Yes. Yeah.
Okay, good. One other interesting feature about lymphatic cells, lymphatic vessels, sorry, not cells, is just like your veins, not your arteries, just like your veins, they've got one-way valves too. So hopefully you can see this can open this way, but it can't come back down. And this is very significant. So it's because your lymphatic system works on extremely low pressure, very low pressure. It's just getting kind of a sucking action from the heart up on top, way up here. And there is smooth muscle around here, so it is doing some of the paracelsus stuff, right, squeezing up. But that said, there's still an awful lot of gravity working against it. So this way, once fluid gets up in here, for example, it presses this door shut so it can't run back down here. And then once it gets up here, it presses that door shut so it can't get back down. So that's what one-way valves do. It just makes sure that as it goes up this ladder, it doesn't come back down. It's a one-way only valve. And that fact tells us the basis behind lymphatic massage. And right after the break, I will tell you what that is. Mr. Placencia, you did a pretty fantastic job, I feel like, yesterday at determining break times and everything like that. What are you recommending today? What are you feeling, sir?
15.
15, okay. I actually realized right after I said that if he said 45 minutes, I was screwed. So thank you, sir. 15 is very appropriate. We'll see you guys back in 15 minutes, which will be, what is that? 30, 40, no, 54? 454? 454, everybody. See you back. Thank you. We don't need to go over this. This is just a picture of some of the stuff I told you. It shows you the one-way valves. It gives you an idea of what's going on here. I actually think the latter explanation is not as pretty, but it's clear what I'm actually talking about. But I just thought I'd show you a picture. But anyway, lymphatic massage, you stroke proximally, move distally. And then you repeat. Because you're always trying to get another guy up the ladder and then fill up those spaces. Another guy up the ladder, fill up those spaces, that kind of thing. Okay. What is going on here? There we go. We don't have to worry about this. You have, your lymphatic system is very interesting the way it works. And essentially, all the lymphatic vessels from kind of the right side of your head, your right arm, and your right upper chest goes into your heart through one main lymphatic vessel. They all come together. And then you've got a thoracic duct on the other side that takes care of the rest of your body. Why is it divided this way? We do not know. But I'm going to go back here for a second so you can see something. Maybe it was right there. Nope. Bear with me. Nope. Maybe it was right there. Oh, it is right here. The little blue and green guy. Sorry, I was looking at the large naked guy, but it's actually the little blue and green guy. The little blue and green guy is showing you actually the areas covered by those two things. So the thoracic duct actually takes care of that whole blue side of the body, whereas the other one just takes care of the green side of the body. And they're just talking about how they go back in the system. This is not important to daily massage, but if you were to study lymphatic massage, it would be important just to understand how all these vessels come back together and go into the heart. And those are just the two main places where they do that. The right lymphatic duct and the thoracic duct. And I'm sure that'll be on your test. But I will be very honest with you, it's not a fact that I walk around remembering all day long, because it just doesn't affect my massage. This is kind of cool. What they're trying to show you is capillaries here, where you've got arteries and veins coming together, right? But they're also showing you the lymphatic vessels. So the lymphatic vessels are in green. They're going through those really beautiful green pea-shaped purpley lymph nodes where they are filtering out any bad stuff and then eventually gets dumped back in the heart. Lymphokinesis. I have never heard anybody use this term before in my life. But anyway, lymphokinesis is the movement of lymph. And lymphatic massage focuses on improving the movement of lymph. And there are some things that your clients can do that you can do to move lymph. One is to use your muscles. Walking especially is great at lymph return. So just like I said, walking was great at venous return, it's also good at lymph return. Breathing, for my yoga lovers out there, has been proven because it creates a pressure differential in your thoracic cavity and your abdominal cavity, and there's a lot of lymph nodes in your abdominal cavity. It actually creates a pressure differential. It kind of creates a suction. And so breathing itself seems to move lymph along. And so if you're really breathing and exercising those muscles, you're going to move lymph along quicker. The lymph vessels themselves are doing some moving because they're wrapped in smooth muscle and they're squeezing lymph up there. And then finally, of course, massage itself moves lymph along. And this would be, by the way, another good argument to massage towards the heart. Again, I'm not a big believer in it. I shouldn't say that. I'm a big believer in it. I believe in the concept. It's not baloney. I don't worry about it very much unless there's a swelling situation. But because these one-way valves, rubbing away from the heart doesn't push lymph away from it. The one-way valves stop that. You're not going to make more lymph kind of go backwards. But if you thought somebody had swelling in an area, I remember when my wife at the time was pregnant with our twins and her legs would swell every day. It's just a lot of baby to have on your pelvis. And it was really uncomfortable for her. And so I would take her legs every morning and effleurage them, and I would do takeoffs and landings, right? I would do everything I tell you not to do. I would effleurage, and I would kind of do it just like I'm talking about the lymphatic thing. I'd push proximally and move distally, push proximally, move distally down her leg like this, and I'd come back up and do it. And you could watch them in the course of 5 minutes shrink. Her legs would go back down. So, and they would swell again tomorrow, the next day, and we do it again. But it was a great way to control something that she's not diseased, there's nothing wrong, it's the way of the baby stopping the venous return and lymphatic return, and we were able to kind of make her comfortable by doing a very rudimentary lymphatic massage by just effleuraging proximally while moving distally. And it does work, people, it works for sure. I mean, I watched it work, 90 days in a row or something, so it works. So I already told you about this. I didn't quite talk about it quite this way, but you have primary and secondary lymphatic organs. Primary ones usually create a lot of the white blood cells and things like that that then get held in the secondary organs, your lymph nodes and things like that hold on to lots of white blood cells. They're kind of like little army outposts, little barracks, little forts full of guys and gals ready to go fight the bad guys off. Yeah, it's all good stuff. You will sometimes hear the term MALT, which is mucosa-associated lymph tissue, and that's things like your adenoids and your tonsils. They're associated with mucus, actually. But in that mucus, by the way, that we all think is so disgusting, there's a tremendous amount of white blood cells. So that the mucus traps the bad guys and the white blood cells gets them. We call that MALT. I don't know. Of your white blood cells, lymphocytes make up about 25%. We will talk about different types of defense cells at a later time. You've got several different types of cells that all fall in this white blood cell category that kill foreign invaders different ways. And we'll get to that later when we do the defense mechanism of the body. That's why I'm kind of holding you guys off there. But you do have some very complex, interesting things that happen, by the way. You have cells that are made, B and T cells that are made in your bone marrow, and then actually go to your thymus to become mature cells and actually kind of finalize their training. I'm not kidding you. And not all of them make it. So it's like they go to boot camp and they learn to be better killer cells, and not all of them make it, and the ones that do end up being very, very good defense cells. So it's not just they come out of the bone marrow ready to go. Sometimes they travel to the thymus to actually become more powerful T cells and to actually mature. Yes, Ms. McDowell.
Is the thymus in the throat, or is that on the heart?
Thymus is in the throat, but I said that with some hesitation, so now I want to check. Yeah, it's in the throat. Thank goodness. I'm sorry. I just felt like I was questioning myself there, and I didn't want to lie to you. It's so convenient as a teacher to be like, yeah, yes, it's in the throat. Yes. And that's where they go to mature. And hundreds of them don't make it. It's really interesting. I don't know why, but they really do go there to mature and become more badass, and the ones that can't cut it don't get in the army. It's kind of cool. That was just a side little fun note. Okay, so your lymph nodes, I already told you, those are the pea-like shaped nodes. You've got hundreds of them along these lymphatic vessels. It's kind of clever, because if one swells, don't worry, you've got more. And when they're swelling, they're usually working on a problem. They're not dead. It's all okay. But they're full, and they're fighting that little battle there. But your lymphatic vessels will go around that one and go to another one, and you've got lymph nodes everywhere. Lymph nodes everywhere. And I told you you have them in the folds of your body. Neck, armpit, groin. You do have something that's in your abdominal region called the cisterna chili. The cisterna chili is an area of a whole bunch of lymph nodes too, but you bend at your belly too. That's how I kind of remember that. So they're concentrated at the folds of your body. That's where you see the most lymph nodes. You see them everywhere, but that's where they're concentrated. Yay, lymph nodes. I'm not pausing for dramatic stuff. Sometimes I see you guys taking notes and I wait for a second because I'm glad you're taking notes, so I kind of give you a second to write down whatever you're writing down. Yeah. Okay. All right. Oh, we already talked about some of these too, some of these other secondary structures like your tonsils, your adenoids. The Payer patches are, again, kind of like tonsils on your intestines. Oh, I honestly didn't read my slide before I said that. They really are intestinal tonsils. I just thought of that myself. So, their job, again, is to catch stuff before it gets out of hand. Your body's very clever like that. Because your body has to be this way, by the way, everybody, because you guys do something very well, too well. You make an incredible environment for bacteria and viruses. Your bodies are full of all the food they like. You're kind enough to keep the temperature exactly right for them. You're like a greenhouse. Like, that's why they want to be inside you. They don't want to kill you. They just walk inside and they're like, this is a mansion. What, champagne? Caviar? Oh my God, the temperature is always 72? Oh my God, I love it in here. And then they're like, let's make babies. And that's a big problem inside your mansion. So that's why you can't just have a security guard at the door. You can't just have mansion walls up to keep them out. You got to also have somebody patrolling inside so they don't get out of hand. Okay? Good stuff. The spleen. I've talked about the spleen a little bit. Spleen is over on your left-hand side of your abdominal area, and it is a big blood filter. It's kind of like a giant lymph node. It really is. It's a giant lymph node. It holds about a pint of blood. I said this before, but it holds about a pint of blood as an emergency backup for your blood if you ever need some. But it also is a giant lymph node, so it too is filtering blood. And if it sounds like there's lots of redundancy here, there is, which is why you can remove your adenoids and your tonsils and you still don't get sick all the time. Because you've got spleens and prayer patches and lymphatic systems and lymph nodes everywhere. So that if you have to remove some, it's not as bad. And you probably know somebody who's had them removed, like they might have had breast cancer, and sometimes they'll spread their lymph nodes in their axillary region and they remove those and things like that. Those are very, very common. But anyway, you've got loads of them everywhere. Everywhere. Just definitions here. Resistance is your body's ability to fight off infection. And susceptibility is how prone you are to being infected. So, So one of the things we worry about with elderly clients is we think that they might be more susceptible to infection, for example. Their immune systems are not as strong as somebody who's 18. With the COVID vaccine, quite often young people actually have a worse reaction to it for all the right reasons. Young people have really strong immune systems. When they get the COVID vaccine, their body's like, oh my God, and it goes nuts. And so they feel kind of crappy for a couple days, whereas sometimes old people, like my parents, got the COVID vaccine, they're like, I didn't notice anything. They're fine. That's not necessarily a good thing. The vaccine's still working for them, but it means their immune system didn't jump into high gear the minute it saw something because they're older. It went, oh, okay. So anyway, I was just trying to give you an example, though, of resistance and susceptibility. You also have, again, this is kind of on the defense side of your body. I don't want to get into it too much, but you have specific and non-specific defense mechanisms. My skin, for example, is non-specific. It tries to keep everybody out. Everybody. It doesn't care. It doesn't care. You could be good stuff. You could be pouring gold over it. It doesn't want it in there. It could be beer. It doesn't care. It's not getting in there. It's non-specific. Whereas specific stuff like B cells and T cells actually learns what foreign invaders are and attacks them very specifically. These are your special forces. They go out and really try to pinpoint a disease, where your non-specific ones tend to just kill everything and tend to just stop everything. The specific ones, though, are the ones that really save you when you have really big problems. Okay. All right. We don't need to go into all those stuff like that. Let's talk about inflammation, though. We've talked about it before, but again, inflammation is actually good. Everything probably that your body does is actually good to begin with. Inflammation can get carried away if it's chronic and it lasts a long time. But Miss McDowell, I want to use your hand as an example because it's a great example. Miss McDowell's hand did exactly what her body should do when you bang your hand up. It swelled, which brought lots and lots of nutrients to that area, lots and lots of white blood cells to that area, and lots of new stuff to help repair whatever tissue was damaged to that area. Her lymphatic system then went on high gear and was sucking stuff out as quick as it could. She's pumping it in there. It's like they're hosing down the area with all sorts of goodness and flushing it out. That's what it's supposed to do. It also had some other really neat advantages. Did you feel like using your hand when it was swollen? No. That's what swelling's meant to do too. It's supposed to splint the area. Quite often when you're swollen in an area, it feels stiff and you don't want to use it. And your body doesn't want you to use it. It's actually meant to splint the area and help protect it, put extra padding around it, and make you not want to use it. So it helps with that too. So it creates this perfect environment for really quick tissue repair by increasing circulation of blood and lymph and everything, which is what you do as massage therapists. So your body's working on the same process you are. And then Miss McDowell's a great example too, because she just did common sense stuff. She just kind of babied her hand a little bit, kind of kept an eye on it, and before we knew it, it's back to normal, and that's how it's supposed to work. Mr. Blygen.
So, with the principle of lymphatic massage, and we're stroking proximally but going distally on the limb or wherever we're massaging, is that the best way to massage in general? Even if we're not doing like the lymphatic style or, technique of massage?
How long do you have to discuss this question? Because it's a hot topic. I don't have exactly an answer for that. I think in general, all right, it's a hard question to answer because there are massage therapists out there that I respect. Like in Canada, actually, there are some massage therapists that have to massage towards your heart. It's part of their license in certain provinces. Anyway, certain states in Canada, you actually are required to massage towards the heart. Like that license requires them to do that. And for all the right reasons. Lymph returns better to the heart that way, especially if you're working like you said, Mr. Blige, that stroking proximally, moving distally. Some people do that all the time because of this reason, and I cannot argue with that. What I have found personally is that a lot of the problems I deal with aren't lymphatic-based problems. They're tight muscles, and it's worth it to not have all these takeoffs and landings and to rub both directions, and that my clients prefer not having takeoffs and landings. And so what I'd really like you guys to walk away with is understanding when you should do this. So when, like my pregnant wife and her legs are swollen, takeoffs and landings, proximal while moving distally. Definitely, because I don't want to dig into her legs and, you know what I mean? But I'm doing it specifically for that. But when I was giving her a regular massage in her back, I forget all that stuff. So does that help? Like, it really depends, sir.
Yes, it helps. I just was curious as to, just curious because it makes sense the way that the lymphatic massage works, with the valves and everything closing.
Yeah.
But, I think that's just a little weird to do for a full massage session to start in one spot and then go distally versus
Oh, God, yeah.
what we
Thank you.
are kind of already used to doing.
Yeah, I feel like you're saying the same thing I'm saying, which is it would be a little bit weird. By the way, every time you do something like that, you lose half your massage. If you guys are doing takeoffs and landings, if every stroke is like this, that means I'm losing the backstroke. And literally in an hour, that really means 30 minutes of my massage went away. So I better have a darn good reason for getting rid of that. That's my logic. And I think you're saying the same thing, sir. Maybe.
Yes. It sounds like it.
Yeah, I think that to have a blanket statement that you should always massage towards the heart does not make sense. I also would never say don't ever massage towards the heart because there are sometimes it makes sense. When you're trying to move lymph and you have swelling, when you're trying to move lymph and you have swelling, massage towards the heart. And even better yet, massage proximally while moving distally. All other things, just massage. That's my advice. Miss Walker T, you have your hand up. You might have had it up for a long time.
Yeah, so when you're saying the lymphatics, I just want to make sure that I'm understanding it right. I don't know why.
No,
maybe
that's what we're here for.
Today, but so like if you ride or you take a long trip, you ride in an airplane and your legs just get kind of big. This is kind of what you're talking about. Like if you've got that kind of swelling anywhere, then you can do the.
Mm-hmm. Actually, that'd be a great example because we know your legs are swollen because you were sitting too long, and so they were folded. and you couldn't get proper venous return, so you now have fluid built up in your legs. We know it's not because you're sick. We know there's not anything major, right? Because major swelling can be a problem. But anyway, we know that's what it's for. This would be an ideal situation for that, and it is lymph that's built up there. It's plasma that's built up there, and we need to get it back in your lymphatic system and back towards your heart. And that would be a great time to massage proximally while moving distally. Great time. But then after we were done with that, you'd be like, well, my shoulders really hurt too because travel really stresses me out, and I'd go back to regular old massage for your shoulders. Cool. Mr. Blygen, do you have more, sir?
No.
Okay, just because you had your hand raised. And by the way, guys, I'm sorry not to give you clear-cut answers on some of this stuff, but honestly, it really is, like, it depends. And some of it's opinion, and I don't ever want you to think that my opinion is fact unless I really know it's fact. Some of it really is opinion about what I've learned and where it's applicable, if that makes sense. So, cool. And there's trade-offs with everything you do. So you're like, I'm going to lose this, but I'm going to gain this. Is that right for this client? Yeah. In general, with normal average people, I want to be getting done as much done as possible, as quickly as possible. And that requires me rubbing the entire time in all different directions. Okay. So, anyway, we've already explained this. Inflammation is meant to bring healing liquid to a damaged area. That's really the point. Yep. Cool. A lot of people use the sharp method to figure out if an area is been injured. They feel swelling, heat in that area, a loss of function, redness, and pain. That should be kind of obvious. I don't think you guys have to memorize that, by the way, but I'm just letting you know that's just one of those terms that people use to kind of identify if there's an injury in that area. And that's local acute swelling. By the way, let's talk about when swelling should worry you. This is very important. I don't worry about localized swelling, so if Miss McDowell came to me with her hand and asked for massage, I would just count that as a local contraindication, especially the day she pointed out to me because it was only like 24 hours old. I wouldn't massage her hand because I don't know. It could be worse. We didn't know, actually. Neither one of us knew at that point. Once it started getting better, I might massage it. Like when you showed it to me, Miss McDowell, it was kind of yellowish, but it was feeling better. I was like, oh, you're on the mend. I might have massaged it then. But the point is, I would have done that. But it's a local contraindication. She has swelling in one hand, and we even know what it's from. No worries. What I do worry about is when somebody is swollen out through their whole body because it suggests their lymphatic system's not working. And they probably wouldn't come to you anyway, but that's a bad sign. And we also worry like when we see one leg swollen and not the other leg swollen and not from injury. What we worry about there is a blood clot. And that's super dangerous. Because if the blood clot frees up, it'll go through your circulatory system and get into their lungs, and it's a pulmonary embolism. And they could die. That's a 911 kind of situation. So if I saw one person where they didn't injure themselves and they just have one leg swollen, especially if they're pregnant, I'm calling the doctor on that stuff. So unusual swelling, yes. But normal swelling on something, just avoid the area. No big deal. No big deal. Okay. Yes, Mr. Brown.
You said if the blood clot frees up, like if it unclogs itself, then it causes the blood to get in the lungs?
Yeah. So what it doesn't cause blood to get in the lungs. Imagine the blood clot is because it really is a tiny scab. It's a scab that's formed inside your vein, your vein in this case. If it comes back there, it's blocking. So here's the thing: is you got a blood clot in your vein, which means you're not getting venous return, which is why your leg is swollen in this scenario. That's why the leg is swollen, because blood can't get back. So now you don't have 10% not returning, you've got 100% not returning that leg back to the heart. The lymphatic system's working really hard to try to make up for that. There's no way it's going to catch up. That scab, which is a blood clot, but it really is a scab, could break loose, but the scab is still a scab. It's just broken loose. So you've got this chunk of scab moving through, and it makes it because your veins get bigger and bigger and bigger as they go to the heart. So it makes it all the way up through there until it gets to a place where there's teeny tiny little veins again, and that's in the lungs. So it goes through the heart just fine because it got through those little veins to begin with. It's a tiny little clot. It goes through the heart. You don't even know. Boom, gets in the lungs, and now it can't get out. It actually blocks up some of those vessels there, and people tend to feel like they can't breathe when that happens. And they are. They're suffocating in a weird way. They can get oxygen, but they can't get oxygen through the lung into the artery and such. And that's where that is. So anyway, sir, it really is a scab floating around that then clogs up another area. Yeah.
Okay, so that leads to my next question. How do you treat that? Like obviously us as massage therapists, we're not gonna go in and fix blood clots because
Right.
that's doctor.
You're not.
But if it frees up and like that, how does the doctor treat it if it's that dangerous?
I don't know I don't know what happens once it's an embolism. Embolism, sorry. I don't know what happens then, what they do with it. I do know that when it's a swollen leg, like if you were my client and your leg was swollen and you're like, I didn't do anything to it and I was really worried you had a blood clot, I would be worried you had a blood clot in at that point. We would call 911 actually, and we'd have you taken to the hospital and they would do an ultrasound on you. Completely non-invasive, completely non-painful, and the ultrasound actually can look at stuff and they'd be like, oh my gosh, there's a clotted vein there. There's a blood clot there. And when it's in your leg still, they'll give you medicine to actually break it apart completely. And they watch you really carefully because they don't want the medicine to make you bleed out or anything, but they'll break it up. That's good. I don't know what happens if it gets all the way to the lungs. I mean, I do know they'd rush you to the hospital to make sure you got oxygen and they'd save your life, but I don't know what they do to clear out the clot at that point. I'm assuming they give you similar medication to break it up there, but I don't know.
You answered the question. I was just asking if it was still in blood clot form.
Yes.
How do they fix it? But
yeah, they've got medicine that'll break it up. And they just like to monitor you though because they want to make sure it breaks up properly, right? And it really gets out of your system and it's all cleaned up. That's what they're doing. Yeah. And by the way, stuff that breaks up blood clots also makes you not clot. So they want to watch you too because now you can bleed to death. Right? Temporarily, they'll fix all that. But anyway, the good news about all this, I know some of the stuff I share with you guys is a little terrifying. They're really good at dealing with this one. This is something they're really good at fixing. And it's worth going to get checked. If you got somebody with really freaky swelling in one of their legs, go get it checked. It's painless. It's an ultrasound. So I have a friend who's very overweight, and unfortunately, when you're very overweight, you're prone to blood clots in your legs too. Kind of for the same reason pregnant women are prone to it. All that weight is kind of keeping venous return from coming back properly. Anyway, he's had it before, where he's got one leg is swollen and he's gone in and they've caught it with the ultrasound. So I remember a year ago, he had swelling again in a leg and instantly he's like, I gotta go in. This time he didn't have it, but it was so easy to go in and just have him scan it really quick. He didn't even go to the hospital. He went to a urgent care place that had an ultrasound and they just did a really quick check and they were like, nope. And they found it was something else minor. Yeah. Okay. Moving right along. That's it, except that if swelling lasts longer than 2 weeks, most people consider it chronic. Acute swelling is instant. Miss McDowell had acute swelling. I'm sorry to keep using your example, but it's so perfect. But if Miss McDowell's hand, thank you, it was still swollen, at this point, we'd start to be thinking it's a little bit chronic. And then you start to wonder, and this is not our job, but then you start to wonder why? Why is this not healing? And if it was Miss McDowell, I'd be like, oh, you didn't just bruise it, you tore something in there or something. To the point where it was really having a hard time healing. But again, we don't have to be doctors. I'm just talking about terms. Acute is quick and brief. Chronic is long. You will have lots of clients come to you with chronic back pain, chronic foot pain, chronic headaches, chronic shoulder pain, and massage is just the best thing for them, and they haven't found anything else to deal with it. Oh, they do talk about immunity. Okay. So this chapter will also talk about immunity, which is your ability. It's really your body's ability to learn. So you have a really neat immune system, and your body really does remember. Just like you remember people that maybe shouldn't be in your life anymore. You remember them, and if you see them, you're like, oh, last time you borrowed my car and didn't bring it back. Whatever it is. I'm not going to loan it to you again. So this is kind of the same thing. Your body really does get smarter. It really does learn to recognize pathogens, because remember, it's got a really hard job. We're all like, why doesn't it just stop every bacteria that's coming in? Because bacteria doesn't look a lot different inside your body than your cells do. Like, it's got to learn to really recognize the good guys and the bad guys. And there's a lot of guys. But anyway, it does. You actually have a learning, thinking system. This is the concept behind all vaccines, is that they expose your body to a tiny bit of non-threatening virus, and you learn what the virus, your immune system learns what it looks like, and it's like, oh, I'm going to remember that, and I'll get it next time. And that's how it works. That's why people with COVID vaccines, they didn't say they'd never get COVID again. Sometimes they do, but they don't get life-threatening COVID again, because they've now learned. Their body's learned, and their body reacts fast enough that it becomes a cold instead of something really severe. Yes, Mr. Brown.
All right, so this was also another concern I was going to ask you, but I didn't know if I should, about the vaccine. So I had caught last year when it was like big. I had caught COVID for like a day. Like it was like the biggest story I got. Like I caught it for like a day. If I get the vaccine, I know I'm going to get sick because I already have the antibodies from it. So does that mean that I basically like don't need the vaccine? Like how does that work?
Yeah.
If my body already built up the antibody.
Yeah. I'm not an epidemiologist, and it depends on which disease we're talking about. But the studies for COVID show that you will get even better immunity. So you might get sick from the vaccine a little bit. Like your body might respond to it stronger because it's seen it before. But that's the cool part. Your body will act. It's almost like you've been vaccinated, sir, and you're going to get a booster shot. So the cool thing is then your body's going to be like, well, what the hell? We just had this a year ago. We got it again. I'm going to be on extra alert. So that's what they found. They found that people with COVID who have gotten COVID and also vaccinated are even more protected than people that just got COVID or just got vaccinated. It's almost like you're going to get vaccinated 3 times instead of 2, or what, you know what I mean? You know, you're not just going to get your 2 shots of Pfizer or you already got your natural shot from Mother Nature. And you would think that would be enough, but apparently it's not. And the reason research suggests that you should get the vaccine anyway, sir, is because if you catch COVID again, you could get really sick. Really sick. And so this vaccine will kind of teach your body like, hey, we really need to remember this stuff and stay on high alert. And you should be extremely immune. My daughter is in the same situation. My daughter got COVID and then she got vaccinated. And all the research shows that she is extremely immune at this point. So that's the good news. That's why I would recommend you do it, sir, but it's not my place. But anyway, that's what the research shows. Yeah. So, but I definitely would not do it because you're worried about getting sick from it, because you're in a really good position to be really vaccinated. That's all. That's it. Okay. So there are different types of defense mechanisms. I want to wrap this up really quick because I got to give you guys your homework and I don't want you to have to, anyway. Your smarter cells that are specific do what's called cell-mediated immunity. They actually recognize foreign invaders and attack them. That's like your T cells. They actually learn and recognize, so they get smarter. I don't know if smarter is the right thing, but they learn to actually read the outer shell of that foreign invader and they recognize it again when they come in. Whereas like your skin doesn't get smarter when it gets invaded. It just still tries to stop everybody. These guys actually get smarter and very specific. And for that reason, they're extremely good at fighting off infection. And then you've also got antibody-mediated immunity, which really, what it really does is ramp up your army and make more antibodies when it senses foreign invaders. So they're not specific, but somebody told them that, hey, there's trouble brewing, let's make a whole bunch of antibodies. And those are kind of the B cells. Yeah. And I think that's, let me go through a couple definitions and we'll stop. I'm sorry, it's a lot of material, I apologize. these are some terms that would be good to know. I suspect they'll be on your test tonight. Immunodeficiencies are when your body doesn't work, when your immune system is deficient and is not working. Some diseases cause immunodeficiencies, like HIV. HIV doesn't kill anybody. In fact, COVID doesn't kill anybody. The complications from HIV and COVID kill people. HIV actually attacks your immune system. And then what happens is you die of pneumonia or a flu or a common cold. So, but HIV itself, what it does is attack your immune system. And then you have an immunodeficiency, and that's a problem. Hypersensitivities are things like allergies when you overreact. Luckily, none of us ever overreact. I definitely overreact sometimes, right? And not just allergies, but when somebody's like, says something, you're like, it triggers you. That's an overreaction too emotionally. Same thing, your immune system can be a little sensitive sometimes. It gets a little pollen in the air, and it gets all pissed off. And it just starts building up all this defense around it, and your nose is running all this kind of stuff, and it was pollen. It was fine. But that was a case where your immune system misrecognized something and went, this is really serious, and it wasn't serious at all. It's not a perfect system. Autoimmune diseases are a problem because that's when your defense mechanism actually attacks your body. And again, I like the emotional comparison because sometimes we do this to ourselves emotionally, right? Like when you say things to yourself that you should never say, like, I'm stupid, I'm an idiot, I'm not smart, I'm not whatever, I'm not successful. Sometimes we do that. We're all learning not to, but that is you attacking your mental health immunity right there. This is the exact same thing where your immune system starts to think like, oh my God, this stuff's all bad, let's attack it all, and it's you. So certain arthritis and things like that are actually your own body attacking itself. I even kind of wonder if there's a parallel there, but there's a whole other discussion about that. And that's it. That's all we got. Okay, good.